Imagine being 65 years old with uncontrolled diabetes since your 20s. Now your kidneys are failing and the only treatment is dialysis. In this case, peritoneal dialysis must be done where 2 liters of fluid is injected into your stomach and sits in there for 2 hours to filter out blood through a catheter. Now repeat this 4 more times every single day. Even though this is a hypothetical situation, this can very well be someone's reality with diabetic nephropathy. It's important to raise its awareness, so let's diabeat this. Before we begin, we want to emphasize we are not medical professionals. Please take a moment to pause and read the disclaimer. Let's discuss a bit more about diabetic nephropathy, prevention techniques, and resources that can be accessed. So what actually is diabetes? Our bodies need this protein called insulin to regulate the amount of sugar in our bloodstream and make sure it can be used to power our cells. If you have diabetes, your body does not produce enough insulin, and so too much sugar stays in your bloodstream, which damages your blood vessels and nerves. Organs like the kidneys are especially vulnerable because they have a lot of little blood vessels that filter blood, so untreated diabetes damages the kidneys over time. Now that we've learned how the onset of diabetes happens, let's walk through how diabetes becomes diabetic nephropathy. First, uncontrolled diabetes damages the kidney's filtering system. This damages a structure called the glomerulus, which are tiny blood vessels that filters blood into the kidney. The accumulated sugar prevents the kidney from filtering through the glomerulus. This results in kidney damage and high blood pressure, which ultimately decreases kidney function and increases risk of kidney failure. Did you know that 1 in 3 Americans who are diagnosed with diabetes have diabetic nephropathy? 25.2% of Medicare patients above 65 are treated for chronic kidney disease, and about 3,000 Riverside and San Bernardino patients combined have chronic kidney disease. Statistically, prediabetes has around 50% prevalence in the city of Riverside, which means that around half of Riverside is in the borderline of suffering from diabetes. Meanwhile, the state of California has a 33.4% of prediabetic prevalence. In terms of diagnosed diabetes, Riverside is at 13.4% in comparison to California's 10.5% prevalence. Lastly, with chronic kidney disease, Riverside's 1/4 affected by the disease. California is at 7.1%. Looking at these percentages, it is evident that Riverside is unequally affected by chronic kidney disease compared to California as a whole. Our high diabetes rates could be due to Riverside's older adult population as well as the ethnic disparity, with the majority being Latinos. And lastly, that 1/3 of older adults with diabetes live below the cost of living. There are several stigmas surrounding diabetes, particularly type 2 diabetes, such as people with diabetes are unhealthy, lack control, or are lazy. These stigmas can come from individuals, groups, communities, healthcare professionals, or even people with diabetes themselves, which then leads to psychological, behavioral, and even medical consequences. In order to mitigate these stigmas, protest against stigmatizing practices. People face restriction on employment opportunities, loss of relationships, being treated differently, and being mistaken for having other medical conditions. Having social support can help too, and this can be your friends or family. Individuals with this condition have swelling in their face, arms, and legs, along with itching from dry skin and numbness or a tingling sensation in their bodies. They also suffer from dyspnea, which is shortness of breath. It's extremely difficult doing simple things like going up and down the stairs because that takes up so much of their energy that they can't even breathe. They're always feeling nauseous because they can't eat, resulting from a metallic taste in their mouth, making nothing even taste good for them. They're constantly tired, meaning they could sleep all day long and still wake up feeling like they just finished working a 9 to 5 job shift. Lastly, we have proteinuria, increased levels of protein in the urine. For a visual, this would look like a yellow bubble bath. We got this list of symptoms from a nurse at a DaVita Home Dialysis Center, so we highly recommend that you please speak to a medical professional immediately if any of these concern you at all.
There are many risk factors associated with diabetic nephropathy. Some of these include uncontrolled high blood sugar, pressure, and cholesterol, which are all caused due to excessive salt and sugar intake. Other factors include the smoking of cigarettes, obesity from improper diet, and family history. Some early treatment methods for high blood pressure include the use of medications to relax the veins and arteries.
Informants help your cells respond to insulin and lowers glucose production.
Statins can reduce cholesterol and protein in the urine to slow kidney function decline.
Lastly, a relatively new medication called Kerendia lowers inflammation and tissue scarring of the kidneys and has recently been proven to possibly reduce the risk of kidney and heart failure in adults with diabetic nephropathy.
As we mentioned in the beginning, if your condition gets worse and progresses to kidney failure, your treatment will focus on replacing the function of your kidneys. This is where dialysis comes in. The two types of dialysis are hemodialysis and peritoneal dialysis. In hemodialysis, an artificial kidney machine removes waste products and extra fluid from the blood, and this is usually done about 3 times a week for 3 to 5 hours at a dialysis center like DaVita. The catheter would be placed in your arm as shown here, which takes about 6 months to heal and use. So in the meantime, a catheter may be placed in your chest. Peritoneal dialysis is done every day for about 8 to 12 hours, usually at home by high-functioning patients themselves. It involves a catheter being placed in your stomach in a surgery that only takes 6 weeks to heal from. The catheter can be used almost immediately, and it delivers a cleansing fluid into your stomach, so the lining of your abdomen is used to filter your blood, which stays in your body. At some point, you and your doctor might decide kidney transplant surgery is your best option. However, the waitlist for a kidney transplant in California is currently 10 to 12 years. If you are not eligible or choose not to have dialysis or a kidney transplant, your life expectancy would usually only be a few months, during which time you might receive treatment to make you as comfortable as possible. Ways to prevent diabetic nephropathy is by increasing regular physical activity. This will help you keep a healthy weight and lower blood pressure. Also, preventing or quitting smoking is highly recommended as it can harm your kidneys and worsen existing damages. Please keep regular diabetes management checkups and, if recommended, more frequent appointments to monitor for any issue. Following the directions on the packaging of non-prescription pain medicine, as it might cause kidney damage in patients with diabetic nephropathy. Most importantly, work with your doctor to address any conditions such as high blood pressure that raise your risk of kidney disease. Lastly, your diet is one of the greatest ways to improve your diabetic nephropathy. Proper kidney function can be aided by including fruits, veggies, and whole grains in your diet. Recipes can be found on DaVita.com. Before accessing these fantastic community and medical resources, please keep in mind that you should always seek the advice of a medical professional before beginning any new program or treatment. The QR codes will direct you to some amazing community and medical resources, such as DaVita, where you can access delicious kidney-friendly recipes. On the Riverside Chronic Disease Collaborative website, you'll be able to inform yourself on community activities and services for the prevention and management of chronic illnesses in the Inland Empire. On NephCure Kidney International, you can find support, information, and advancing research. Finally, on Arrowhead Regional Medical Center, Diabetes Fit, and Riverside San Bernardino County Indian Health Diabetes Program, you can access support, knowledge, and skills to properly enhance your life if you have diabetes. If you enjoyed this presentation and would like to stay connected with us, please feel free to follow our social media accounts by scanning these QR codes or typing the links onto your device. If anyone has any questions, please feel free to ask our email fpl2022group4@gmail.com or our social media accounts. Thank you so much for your interest and time.
Here are our team credits and our sources of information.